Hello everyone, welcome to my presentation. My name is Widad. I'm a palliative care nurse from Saudi Arabia. I'm about to finish Masters of Nursing from Monash University, Australia, Melbourne. The Health Promotion and Education Unit requires a health promotion program to be implemented using the program logic model as its last assignment. So this is what I will do in this slideshow. I hope you will like it, but before that, let's have a look at the next video.
Everyone has the right for the end of their life to occur with dignity, respect, and free from pain.
Would you like a drink of water, Dad?
When a person decides that they want to die at home, the multidisciplinary team, which includes the home care worker, enables this as far as possible, medically, emotionally, and spiritually.
You understand that he's been quite clear about not wanting to be resuscitated. I think we should honour that.
Yes, we will.
I think we're at that stage, Janet.
The most important role of the care worker is to provide direct care for the person who is actually dying and to provide reassurance for all the people who love that person and to give them emotional support.
It means they can be surrounded by the things that they love. They're in familiar surroundings and they're with family and friends.
Looking back, it means so much to me now to have been involved in his care alongside the nurses. The care team were incredible. They made sure Dad's wishes were followed according to his advanced care planning.
Okay, from the previous video, it seems that it's very clear to you that this presentation will be about palliative care for elderly at home. So let's get started. By the end of this presentation, you will be able to define palliative care, identify beneficiaries of palliative care services, analyze the chosen valuable population in terms of demographic characteristics, the social determinants of health, health literacy, and health disparity. Describe the program logic model and its major components. Identify stakeholders and partners. Explain how to maintain a sustainable health promotion program. Recommendations and conclusions. And finally, my references. Excellent healthcare is one of the most important goals that many people and health organizations seek to achieve. Health is defined by the World Health Organization as a state of complete physical, mental, social, and spiritual well-being. Palliative care aims to increase the quality of life of the patients facing chronic and serious diseases. Palliative care seeks to reduce the pain and symptoms associated with the diseases. In addition, provide social, emotional, physical, and spiritual support for the patients and their families from the beginning of the diagnosis until end of life and bereavement. Palliative care and its services are provided to anyone at any stage of the disease, and they are not limited to hospice care or end-of-life care. There are potential conditions of palliative care, especially for those suffering from incurable diseases such as AIDS or chronic diseases that cannot be cured, such as cancer, or patients in the final stages of life. Service providers are doctors, consultants, pharmacists, nurses, social workers, religion advisors, and other specialists who will help according to the needs of the patient and the families. The target group in terms of demographic characteristic. The group selected for this work are palliative care customers, and especially elderly who receive palliative care at home. In Saudi Arabia, they must be 60 or older, men and women, whether they have caregivers, their family members, or they live alone. Social determinants of health and health literacy. Saudi Arabia's culture of caring for the elderly is the responsibility of the family. The most important reason for this is the Islamic religion. It is required in Islam to have mercy and respect when dealing with the elderly. Therefore, most elderly patients are discharged from the hospital to receive treatment at home and among their family and loved ones. Research in older people receiving palliative care in Saudi Arabia is rare and almost unavailable due to cultural sensitivity and rarity of the specialty. In this case, I'll use research done for other older patients receiving palliative care from different countries around the world. Social determinants play an important role in health status. Social determinants aspects that affect people's health status, such as social income. High income people pay for their treatment, while poor ones cannot. Education and literacy in Saudi Arabia, for example. Older people cannot read prescriptions because they speak Arabic and the prescriptions are written in English. Can you imagine the difficulty of getting someone to read and explain to them? In a study conducted in Iran to assess the health of older people, 354 elderly people were interviewed during clinic visits and home visits about their understanding of their own health conditions. The results showed that 79.5% of elderly didn't have sufficient knowledge of their health, leading to poor health. The reasons were that they are uneducated, unable to easily reach health centers because of poverty or long distance. Limited health literacy is a widespread threat and is associated with low socioeconomic situations, especially in societies with a high incidence of social, race, and gender discrimination. A study confirmed by the National Organization for Hospices and Palliative Care in the United States that only 8% of African Americans participate in palliative care and hospice care, compared to 83% of white patients. Researchers didn't have enough data on what could be the reasons, but they believe that there may be cultural or socioeconomic issues preventing older African American patients from taking advantage of palliative care settings and services. Health disparity. Although there is much effort to eliminate health inequalities, many palliative care patients with limited incomes continue to have difficulty accessing and paying for treatment compared to high-income patients. Researchers conducted a survey in 2013 in the Pronix to find out ethnic disparities when providing specialized palliative care for older patients. They found that 37% of Black and Spanish patients had no evidence of specialized palliative care compared to other patients. This is a huge gap in the healthcare system. The healthcare system has become more flexible in dealing with patients' preferences. Many older patients prefer to have palliative care at home to spend time with their families and loved ones. But there is a problem. Family members, home caregivers, they are overstressed and they're so responsible about the conditions they have. They face significant challenges such as lack of knowledge on how to control pain and symptoms, lack of assistive devices such as a wheelchair or electronic bed, lack of palliative care home care teams who can carry out constant visits to home and provide support. Therefore, family members need urgent psychosocial, spiritual support to help them help their patients. Although palliative care in homes, in the European society in particular, is very important, still there are health inequalities, even if there are updated systems and policies to help healthcare professionals in home-based palliative care services. Still a lot of unexplored gaps that need to be changed through research and cooperation between communities and health organizations. The problems in the health system or services provided that can be routine in research, discussed in conferences and meetings. But what about the other problems, the hidden ones that we don't know about, especially with regard to elderly persons? The problems with home-based palliative care in general is the increase in the number of elderly patients with chronic diseases, leading to increase in hospital admissions, lack of nursing and medical staff specializing in palliative care in the region, lack of palliative care departments, units, hospice care settings, family challenges, as I mentioned, lack of support and lack of knowledge. The program logic. The main goal of this program is to improve palliative care for older people at home in Saudi Arabia. The objective? By 2018, 50% of elderly who benefit from palliative care services in homes in Saudi Arabia will be contacted within a month. The outcome increased the percentage from 50% to 70% by 2021 for elderly people who receive palliative care in Saudi Arabia homes by providing better quality treatment and following global policies regarding palliative care. Okay, so this is the program logic model. We will start with the input. We need to invest staff, facilities, equipment, money, and time. We need qualified and specialist palliative care home care teams. We would like to have access to facilities, research, and international policies. Sufficient funding to help in the intensive home support for the family and caregivers. And the community engagement is very important in this phase, in the changing process and decision making through empowerment. The output, which are the activities and the participants. In this case, we will conduct workshops. We will effectively communicate with the stakeholders. Meetings done to collect data. Community awareness projects designed. Access to global policies for palliative care facilitated. Collaboration with experts and staff in the field initiated and staff training started. Efforts made to assist families of patients. Work with the media. All of that outcomes we would like to reach the satisfactions of the participants, the persons who are in need for this care. In the outcome, which are the changes that we're looking for, the learning, the experience, and the knowledge, whether they are short, medium, and long-term results. Increased awareness of palliative care in society. The number of people wishing to work in palliative care increased. Government support provided to patients and families at home. Decreasing the number of elderly people admitted to hospital. International policies used in the development of palliative care in Saudi Arabia. Stakeholders and partners. A personal effort does not solve the problem, even if it's simple. So we need to combine efforts to achieve a desirable improvement in palliative care for older people at homes. We need government support, represented by commissioners from the Ministry of Health, the Ministry of Labour, and the Ministry of Finance, as well as stakeholders from the Ministry of Health, the healthcare professionals, the leaders and the educators. Not forgetting also the support from the community, the partners who own non-governmental projects, such as the charities and the volunteer organizations. We need influencers to communicate with the community and help and raise awareness. We need media to disseminate reports of events and lectures to as many members of the society as possible. The supporters of any project help to communicate and cooperate with each other and with the higher authorities as well, to achieve the goals and facilitate the obstacles faced by the founders of any project. Actions for sustainability. Through the process of this project, we can maintain excellent health and results in a sustainable manner, such as using the following points. Keep supporters constantly informed of the results to ensure financial support. Highlighting the role of the society, patient, and family in this project through the awareness and impact on them, their feedback and satisfaction. Develop good communication with the family members. Healthcare practitioners who can do the home visits are able to do evaluation for the patients and their families' needs. Family involvement in this is very important to complete the project. The family is the core of the community building, so we have to make sure that we communicate with them properly. Use media to report on activities or gatherings to support patients and their families. Use online fundraising, the online charity, the online volunteering groups. Develop a sustainable plan for short-term goals that will work. Evaluation before, during, and after the project to predict the progress of the work and reach the desirable results. Ethical consideration. Palliative care in general is a humanitarian duty towards those who need it. Dealing with patients in palliative care should be well understood because people differ in their habits, preferences, and cultures when they get sick. It is therefore important to understand patients' wishes and not to judge or ignore that. The principles of ethics are beneficence, to do good, non-maleficence, cause no harm, respect and autonomy. Ethical considerations in palliative care include the right of the patient to be treated with respect and dignity, management of pain and symptoms, family involvement in all stages of patient's illness, the right of the patient and the family to make decisions in the care plans or even withdraw from the treatment, access to medical care facilities, treated fairly like other patients. Although the nursing care changed to comfort care, still the palliative care patients and elderly patients at home need to be treated equally. And finally, informed consent to increase their autonomy in decision making. In summary, palliative care and its services were explained. Beneficiaries of this care were identified. The problems experienced by older persons in palliative care and their impacts on their health, such as health disparities, education literacy, social determinants of health, all were mentioned in this slide. The program logic and its components were explored in a diagrammatic way with an inclusion of the main goal, objective, and outcomes. Since the health system and the health laws is made up by experts, educators, and leaders, human beings, it means that we can adjust it, grow, and expand health systems according to the needs of the workers and the needs of the healthcare providers and the caretakers. Simple, successful goals can be achieved through teamwork to improve the quality of programs offered to valuable groups such as elder persons. At the end, there is nothing that frightens patients in palliative care and their families more than thinking about illness, pain, and death. Together, we help patients and their families to have less pain, to feel valued, and to be treated with empathy and compassion. Thank you for listening, and I wish you all best of luck. This is my reference list. Thank you.